Good afternoon, everyone. My name is Shane O'Brien. I'm going to be doing my presentation on poisoning drug-related deaths. As you can see in the left-hand corner, in the United States as of 2019 to 2020, there were roughly 658 million people, and in the U.S. alone, there were approximately 162,000 deaths caused by drug poisoning. That is a crude rate of 24.6 deaths. Here in Nevada, compared to Alabama and California, we did pretty well on the number of deaths. Where in Alabama was 11,217, and California had 84,800 drug-related deaths, and in Nevada was just 10,897 deaths caused by drug poisoning. As you can see in the top right-hand corner, it seems that males outdid females in deaths per year, with them being over 111,000 between 2019 and 2020, whereas females only overdosed and died due to drugs at 50,000 in that whole year. The ages between 30 and 60 years of age is where the most of these deaths occurred. When it came to ethnicity, African Americans were the most who died due to drug deaths. The cost of all this, of the drugs being, the cause of most of these deaths, overdose and poisoning, was $550 billion between 2019 and 2020. Now, some good and critical strategies that are helping with dropping the death rates of drug poisoning deaths are monitoring and making it harder for prescription drugs to be dispensed. That goes for all the hospitals, and also like if you go to CVS and Walgreens, they kind of cut back on, especially the opioids and stuff like that. Implementing more quality-based interventions, especially in low-cost neighborhoods. This is helping a lot too with the drug poisoning and deaths. Educate the public on drug and drug overdose deaths to the public and the treatment that are in their communities. So basically the public health department, maybe giving some classes or passing out pamphlets and stuff like that. This is what's helping stop these deaths here. According to the U.S. Department of Health and Human Services, DHHS, some preventive measures that have been done to help reduce drug overdose deaths are primary prevention, which focuses on what is causing the drug overdose deaths. The other big help is the use of harm reduction. This is to look at reducing the overdose use of drugs. Evidence-based treatments are another big help. This type of procedure focuses on programs that have been statistically proven to work. And then the last part that is really big in cities use is a recovery support. This can help employers along with peers to not continue with the drugs of that individual, which, as you know, if a person goes off of drugs and then they go back on it, they can overdose really quickly because their tolerance isn't that good. As you can see, all the citations is on the bottom right hand corner. Mainly got it from a lot of the data tools that we were using throughout the semester. And then of course I went on to the CDC Injury Center to find out some statistics and the preventions that were completed or that were done. Thank you.